All right. Hello. Good evening, everyone. I think my computer is a little slow. It's a little intermittent, so I apologize. But welcome. Good evening. I hope everyone had a great weekend. I had a pretty good weekend. I went to a movie theater. I don't like movie theaters, so I went to the movie theaters, and this was like the first in like 20 years. So it was all right. I don't know if I'll do it again, but it was okay. So I hope everyone again had a great weekend. I think Halloween is coming soon. For some reason, I thought it was last month, but my days are always mixed up. So, anywho. So, as usual, we have wonderful guests for you this evening. And thank you all for tuning in once again. And tell a friend so they can tell a friend. And then they can tell a friend. Spread the word, okay? Because we can use your all you all support, and we appreciate it as well. So once again, we have great guests ahead. We're going to talk about cancer. This is a topic that I'm quite sure everyone can kind of have questions and conversations about, unfortunately. So before we get to the show, let's get to my co host, Mr. Gerald C. Anderson. Come on down, Gerald. Come on, Gerald. You get on scene. You get on scene.
Couldn't find that mom. That cursor. Hey,
Hey. So yeah, so great weekend. How was your weekend?
my weekend was good.
Good.
Didn't do anything at the University of Miami beat Florida State, so yes, it was definitely a great weekend.
Oh, is that football?
Is that football? Lord have mercy. Yes,
I don't
that's
know.
football.
Oh, okay. I don't know about those things. So
I see, because you don't even go to the movies. It's been 20
I
years.
know, but I was glad I actually went. It was, a friend of mine talked me into it, so I was like, you know what,
20
I'll
years,
go. Huh?
20 years without going to the movie theater.
It's probably been longer than that. It's probably been longer than that. And I know now you can eat, you can drink, and you can recline your seats and all that. And it was really good, but I really enjoy being home and watching a good movie so that I can turn over at any moment in time and go to sleep. I don't
Lord.
want to have to get up, get in the car, drive home. Then, that's a lot.
So what the last time you went, the movie was probably a nickel, right?
It was like 250 if I'm not mistaken. And now it was like almost 30 bucks, 50 bucks before you were even done with
I know,
getting a
right?
snack.
You go there. You don't go there hungry.
Man, listen, I was like, woof, theater's expensive. But yeah, the movie was really, really good. So, and I was in really good company. So it
Yeah.
was nice.
Okay. Well, I'm glad you enjoyed the movie theater
Yes. So it was fun.
that everybody else has been to.
Yeah,
So
I
let
won't
me
do it
get this.
again
So
no time soon.
kids that were born in 2005 have been to a movie theater and you had never
Yeah, just not my thing. Just not my thing.
been. Wow.
So yeah,
Mm-mm.
so we have fabulous guests once again, on the show, and we're going to talk about cancer. And unfortunately, this is a conversation that never gets old. It's always a current events, so to speak. And that conversation that's always having in homes, unfortunately, and with it being Cancer Awareness Month, which is another reason why the conversation shouldn't just be once a month. It should be, something that we
Year round.
continuously, yeah, year round.
Yeah.
So yeah. So anything else you want to add to that before we start, like having our guests come on? We have to have Buff. We finally got Buff, the buzzer beater. She's
That,
back.
yeah. I don't think she's back though.
Oh darn! Did we lose her again, Gerald?
It's like
Did
we
we lose
lost
her?
her, so
Ay, ay, ay. I
she
tell
snuck out of
you.
the green room.
Oh, gotta love her. Gotta love her. but yes, so we have our Buff whenever she comes back on. If we could just, I guess, get her on screen at some point.
Right, right. I
Let's
guess
go
we can
to our
take
guest.
this.
I guess we can go with our first guest. And I want to thank everyone ahead of time for joining us. I see Rhonda is on. Thank you, Rhonda. I see Nikki is on. So thank you all for joining the conversation. And
Hey,
again, if you wanted to say something.
Shantae is on.
Oh, Shantae. Oh, yeah, Shantae is on. So, again, if you have any questions, feel free. Even if you have comments, feel free to add those online, and we'll definitely post those. But we appreciate everyone's support always. So, all right. So, Gerald, go ahead. Who we have up first? Let's get to
Well,
getting
remember
classes.
we're doing a panel tonight, so it's not a first.
Yes. Oh, and I love when we do panels. I
Yeah,
really
I think
like
it's
the
the
panel.
whole movie thing that's throwing you off. Yeah.
Yeah, that's why I can't do theaters. It's too much,
So,
too much.
so our guest tonight is um, a physician, an educator, and a champion in proactive health. She spent 2 decades in internal medicine as a doctor, caring for patients, and also teaching the next generation of physicians. She is the author of the essential new guide, How to Help Your Doctor Help You. So let's
Good
welcome
job. I'm glad you sound that out. Good job. Good job.
Ms. Dr. Bonita Coe, and then
Hello. Good
Hello, everyone.
evening, doctor. Good evening.
our other guest is someone we all know and love. She is a author as well. She's also my very good friend, and she survived cancer. So I think I was around her when she came out and told everyone that she survived cancer. So, I'm very appreciative of God blessing her with that. So let's bring to the stage Miss Beryl Brackett. Sister Brackett.
Brother Gerald.
So, yeah, so this like we were talking before the show that this is 1 month out of the year where we focus on breast cancer awareness, but it should be a year-round conversation. But since we have this month, we're gonna we're
Mhm.
gonna dedicate this show to talking about breast cancer. So we wanted someone from the medical team side, which is Dr. Coe, and then we wanted someone who has gone through it and survived it. That's Sister Brackett. That's a joke for that sister. Sister Brackett. So we want you guys to relax. We're gonna talk about it from a medical standpoint and from a survivor standpoint. So you guys ready?
Ready.
Come on, where's that?
Ready.
Yes, come on. All right. So Dr. Coe, why don't you
It's
tell us a
it's
little bit
Monday
about
evening. They like, listen, could we heavy this up, please?
so Dr. Coe, why don't you tell us a little bit about you and your background, other than more details than what I gave.
All right. So I am in my 28th year of practicing internal medicine. I've spent all of my career taking care of patients as a primary care physician. I have worked in private practice, group practices with other physicians. I have worked at teaching medical students and residents, being on medical school admissions committee, taking care of patients in various settings, academic settings, in the hospital, in nursing homes, in the office. And so I do the range of primary care, general care, preventive care. And so my passion is helping patients take care of themselves, be proactive, and prevent illnesses when you can. And when you have chronic diseases, manage them as best as you can. I'm big on helping people eat healthy to manage diseases and prevent diseases when you can. I tell people think of food as medicine. I do prescribe medicine, of course, but I do try to help people avoid medication when possible. And that is what I have been doing for the last 28 years. And I just wrote a book called How to Help Your Doctor Help You, a guide for men and women to manage health proactively, that released November 2024. So it's a culmination of all of how I wish that want to help people be more engaged in their healthcare, when you can come to the doctor and be a better advocate for your own healthcare and assist your doctor with your care instead of being a passive uh, recipient of care. And also, I pour into that book information about eating healthy, and the big three: high blood pressure, diabetes, high cholesterol, how to eat healthy, preventive care, including cancer prevention, which we're going to be talking about breast cancer prevention today and screening, and a lot of stuff in between.
Okay.
And that's what I do.
Yeah. Awesome. And you have a consulting company, right?
So I actually did start doing that a couple years ago, outside of the office, um, consulting, where I am the kind of the helicopter looking at someone's care and giving advice about someone's care without taking over their care. Because sometimes, a lot of times, people go to the doctor. Um, a lot of times your doctor may not have time to do what, and I've been in the office for many years, so I know what that's like when your schedule's loaded up with patients. So as a consultant, I have the time to really go over your care, go over the medicines, explain things, and be that consultant and second eye and second opinion on what's going on with your care, and um, go down the rabbit hole with you, so to speak.
Okay. Hey, so Beryl, would you give us your background, please?
Which one? So let's
All of it in 5 minutes.
let's talk about I am a survivor. And I remember, Gerald, when you found out about it, you were writing and you said, well, no, I'm not going to bother you. I was like, no, just let me have it. So I started editing your book way back in 2010, all of your books. Remember that?
Yeah.
Yeah. So I'm
Right
a
there
breast
when I
cancer.
first started.
Yep.
Yeah.
So I am a breast cancer survivor of 15 years, and I am so grateful. I am so grateful. I went through the steps, all of the steps. And yeah, Dr. Coe, you talked about prevention and everything. And, as women, we do everything. Well, some of us anyway, we do everything we need to do. We get our mammograms, all of our checkups, but sometimes it just doesn't work out like that. And when I started my journey through breast cancer, there's no history in my family, at least that I know of. Back then, a lot of people didn't talk about what they were experiencing in their health, but I didn't find anything that tied me to breast cancer. So there was no way I was going to have breast cancer. There was no way, because that's what the study showed, and that's what they said. No, it has to be in your family, but that wasn't my case. So when I started, and I got the phone call that was it. So I just started running, trying to do what I needed to do, go to all of my doctor's appointments, which I always did that anyway, but just trying to think healthy, think positive, and get everything done. Sometimes as women, or anybody that's struggling with an illness, you're tired. You don't want to do anything else. You want to get 2, 3, 4, and 5 opinions. And by that time, your time is running out, if that makes sense. So I just kept going and just kept being positive. And through all of that, I've written several journals. One journal I wrote is a breast cancer healing scripture journal, because I knew that I needed something that helped to pull me through. And I knew that other people did too. So I wrote that journal as well. And I also wrote a journal about surviving chemo. That was one of my best friends who passed away about a year or so ago. And we talked about her chemo choices and what she had to do and stuff like that. And we laughed about things. And I would say, hey, oh, What do you think about this? What should we put in this right here? So I know that there's a need for more conversation around our health as women, or actually in the Black community. So I decided to put out those two journals because I know that journaling helps me to feel better. Now, also wrote a book called Shadows of Strength. This was a nonfiction book around breast cancer. So that section for me. So I'm also another author. I write children's books as well. But I know for me, in order for me to get through things, I have to write it down and get it off my chest. 5 minutes.
So
That
that,
was 5 minutes.
yeah, so that brings up a lot of, thank you so much for that, Beryl. That brought up a lot of different questions in my mind, and maybe Dr. Bonita and Beryl, maybe you can answer it as well. Because I don't follow, cancer, breast cancer, so I'm not quite, aware of it. But I would like to know if there's like new treatments, and how does like our current technology, like AI, how does that impact like the treatments? And if there's new treatments that with the technology base, is that anything that we should maybe foresee in the near future, perhaps?
Well, first, I like to step back for a minute and pick up on something that Beryl said as far as not expecting to have breast cancer. The first thing that a lot of us need to do is talk to your family about illnesses that they have. A big problem that we have is people in our family will not talk about the medical illnesses that they have. They will take it to their grave. Some people think that it's a weakness to discuss their medical illnesses. And so that is early on in my book, I talk about pressing your family members to tell you about their medical illnesses. And the talking point that I have told my patients all the time is bring up the younger people and the children in your family. Tell your family members, please tell me about your medical illnesses, because your medical illnesses and what you have will impact us, and we can take that information to our doctors so our doctors can help us have better health and better outcomes in the future for me and the children behind them and the children behind them. And that is even more true today because now we have genetic testing
And gene therapy, correct?
Well, before we even get to gene therapy, genetic testing is appropriate for people who have a family history of certain cancers in their family. So certain cancers in your family, how many people have the certain cancers in their family, which side of the family the cancers are on, it really matters with respect to cancer. And so with your doctor, which I do with all my patients, you take a family history and you can determine just by family history who should have genetic testing. And so even though you don't think you're going to get cancer, but your family history can determine whether you need genetic testing. And we have now more and more genetic tests that can check for hereditary cancers. And sometimes cancers comes in groups. So just because, say you have family members with prostate cancer, but sometimes prostate cancer goes along with pancreatic cancer and some syndromes, or skin cancer and some syndromes. So sometimes it's not obvious what a cancer syndrome could be in your family. And so often I refer people to medical geneticists, which your doctor can do, but genetic testing is very important. But you don't know if you have that increased risk if you don't know your family history to tell your doctor. Now, once you have genetic testing and the genetic counselor goes over your results, The recommendations for screening for various cancers may change based on your family history and the results of your genetic testing. For example, for mammograms, based on genetic testing and your family history, your doctor may recommend that you start getting mammograms earlier than the average risk person at age 40. Maybe you should start at 35. Maybe you should start at 30. Maybe you should start at 25. Maybe you should be getting breast MRIs and mammograms alternating sometimes every 6 months. So your breast cancer, specifically talking about breast cancer screening, sometimes how you should get your screening may be different depending on your family history and depending on your genetic testing. And for breast cancer, specifically, there are risk assessment scores that your doctor can do with you. One is called the Tyrer-Cuzick score. I'm going to type this in, which I recommend you do this with your doctor, and instead of necessarily going online and doing it, because the doctor needs to explain to you how to do this. But for breast cancer and ovarian cancer in your family, the Tyrer-Cuzick score can determine if you're at increased risk and whether you need to get breast MRIs in addition to mammograms, and when you should start that. So all of that is very important, starting with talking to your family about what diseases that they have. And then based on genetic testing and the type of cancer that you have, if you've been diagnosed with cancer, targeted treatments are now available. So you asked about treatments for breast cancer. There are targeted treatments based on the genetics of your breast cancer.
Is that covered by healthcare?
Oh, yes.
Okay, because it's quite difficult to get healthcare when you have, can't getting the treatments with cancer. I've heard a lot of horror stories with that, with healthcare and cancer and the difficulties with that. How, what treatments are there out there that are perhaps maybe not free, but, affordable if you don't have healthcare?
Well, that's why you have to work with your primary care doctor, with your cancer specialist, so they can help you advocate for yourself. Remember, also, clinical trials are also out there. Clinicaltrials.gov. Don't be afraid of clinical trials, because there are a lot of
I'm afraid of clinical trials.
There are a lot of clinical trials out here, and we need more people in clinical trials from people who look like us, from genes from people who look like us, because ultimately a lot of us are going to have treatments, but we need more people like us in these clinical trials. But a lot of times there are clinical trials that are available for where you can get treatments. And clinical trials, they are structured, they are free. So those are three things I can recommend. Stay close with your primary care doctor, your breast specialist, your cancer specialist, so they can help you advocate and navigate your cancer treatment. And there is also a group I can tell you about. It's called Touch for Life. It's specifically for it's a nonprofit group. A friend of mine started it. She is a breast cancer survivor, and her program inside of her organization is called Black Genes Matter. Touch for Life.
Okay.
And so she is big on targeted treatments for the type of breast cancers that Black women have. often we are found
Monte has a great question here, and I really would like for us to tap into that, because that's something that's not mentioned and talked about as often as women, but this is a concern as well. So Shantae, thank you for that question.
And before you answer that, Beryl also did an article a few years ago in the magazine about a man who had breast cancer too, I believe.
Yeah.
He was a good friend of ours. He didn't think anything of it either, because it's
Mhm.
not widely talked about or anything. So he
Mhm.
didn't think anything was going on there, but he got it, checked out, and he was surprised, and he did everything he needed to do. So he's still here. But yeah, but it's not widely talked about at all about men. So for my sons, I tell them, be aware of your body, because I
Right.
have breast cancer. Make sure that you are aware of your body. And if something doesn't feel right, go to the doctor and get it checked out.
So for men who have a first degree relative with breast cancer, so mother, child, or sister, they should talk to their doctor about genetic testing, because men can have carry the breast cancer gene, and men certainly can get breast cancer. And often men have more aggressive forms of breast cancer.
Ah. Hmm. Yeah, see, that's something that we don't hear much about. We, hear about it, but it's not as widely conversation as much as women. And again, I really would like to know, how does technology play into this? Because we have so many, like robotics and AI again that I mentioned. How does that play in like treatment and diagnosis and so forth, and even chemo?
So one thing I can say is that most breast mammograms now are, when you're getting your breast mammograms, they should be 3D, or so you can look on your mammogram report. It should say 3D or tomosynthesis. That's the way. That is a better way of doing the imaging for breast cancer screening now. Um, there are some up and coming modalities where radiologists are using AI to help them with better diagnosing breast cancer on their imaging modalities now. I am, as an internal medicine doctor, I am more on the prevention side, the screening side, not so much on the treatment side. But I know that as far as treatment, there's lots of ways that we are using AI to help doctors be better diagnosticians, better clinicians, and using AI to help us better with treatments and monitoring patients. So that is up and coming.
I have a question, um, Dr. Coe. When you speak about preventing breast cancer, can you explain that?
Well, the main thing as far as prevention is knowing your family history, getting genetic testing when it's appropriate, getting your imaging on time, whether it's mammograms, breast MRIs. Also, I still say it is a good idea to do your self breast exams, getting to know what your breast feel like, because they're right there. They're with you all the time. And so still many breast cancers that you can feel are still found by the patient. So getting to know your breast. If you're still having periods, you should do your breast exam about a week after the last day of your period, because your breast can be more lumpy and bumpy during your period. So all that is about prevention. In addition, if you smoke, quit smoking, low fat eating, getting regular exercise, increasing your intake of fruits and vegetables, especially vegetables. All of those things goes a long way with cancer prevention in general, not just um, breast cancer. Low fat eating is a big one. Eliminating eliminating red meat and processed meat. So bacon, sausage, ham, cold cuts, deli meats, hot dogs, all of that goes a long way to decreasing cancer risk in general.
Well, doctor, I got a problem with steak now.
This is gonna say that.
Here we go.
That steak, that
That's
T-bone
usually
steak, man. If it's
here we
cooked
go.
right, ooh.
Usually when I say that, that's when people tell me I done ran it into the ditch.
I gotta stop you at. I gotta stop you at some point.
Don't shoot the messenger.
But we had a guest on a prior show, and correct me if I'm wrong, Gerald. I believe she said she had like a treatment center after for those that struck had cancer or was a cancer survivor. Like she had like a treatment center, like for meditation and just to kind of recenter themselves and kind of get their energy or focus back. How I know this is important, but how important is it before and after finding out is like just the balance of your mental capacity? How important is that during or after?
Well, that's on the list of cancer prevention is minimizing stress and all of that. Mental health. That's on the list as well.
So how was that for you though, Beryl? How'd you deal with all that while you were going through it?
I did a lot of meditation, a lot of praying, just keeping my stress low and being positive about things. Getting away from it all, having a vacation before treatment started, and then having my vacation after the treatment was over, just trying to stay in a place of, for me, gratitude, and then in a place of being positive. And what helped me the most was that I did not entertain any negative thoughts from anybody. So for me, I was taking care of my mental health by not listening to people who had negative things to say when they really didn't know my whole entire story of what I was going through. So that's what helped me. I stayed away from people that, said certain things. I made sure I stayed away from them. And then my family. My family was a huge help, and my friends.
Okay. And then Rhonda has a question about sugar. Can sugar cause cancer?
Diets that are high in sugar and sweetened beverages, that actually is on the list of things to do when you're trying to prevent cancer. That is on the list. It is. It's kind of hard to do those kind of studies, especially in the United States, because there's so much sugar in everything that people eat. But it is on the list a lot, as along with low fat eating. So as a doctor, I would say yes, it is on the list. In fact, I just worked with Howard University Office of Communications this week, and we just put out an article this week on their website. It's called The Dig, DIG. If you just put in The Dig Howard University, we just put out an article on breast cancer. And so I actually was just doing all this for publication for the lay public this week. And diets high in sugar, it is on the list.
So are all of these preventive or just lower your risk for getting cancer? Because can we really prevent cancer by not eating steak? I'm going to put that up there first. So are these preventive or just lower your risks?
So to me, preventive and lowering the risk kind of means the same thing. It does not mean if you do all this thing that you 100% won't get breast cancer, but certainly they all lower your risk. Will it 100% mean you don't get breast cancer? No. But everything that I said in my list helps lower your risk for a whole lot of things,
Right.
not just breast cancer.
And if you can, and if it's not too much to ask, put in those, I think you said the three top, like diabetes, cancer, and it was heart
High
disease.
blood pressure.
It was the early part of the show. You mentioned it. And I really would like to have that up on the screen because I actually heard that before. And this is something I think I should remember, as well as maybe this, some viewers out there might want to remember as well.
So what I said was in my book, as far as tackling, what I said was the big three. So I said high blood pressure, diabetes, and high cholesterol.
Okay.
That's what I said.
Yeah, and I think those are really that was a really good point I think you made, because I actually heard my grandmother used to mention that years ago. And she used to always say, well, she had a different way of saying it, but I can't say it on air. But she had a whole nother way of saying it. But yeah, that was actually a good point.
So with those three things in mind, would you agree that it's very important to get your annual physical every year? Because in your physical, they check for these things all the time.
So I call it, instead of using the word physical, I call it a preventive health visit. And when you have your preventive health visit with your primary care doctor, yes, your primary care doctor is going through all of these things. But as a primary care doctor, we have a list. So every time you see us, we're looking at what you're not up to date on, and we're supposed to be bringing it up. We don't wait to just once a year to be bringing up things. So say you're here for your high blood pressure visit, but if you're past due on your mammogram, we need to be bringing it up. If it's time for your PSA test, if you're a man with a prostate gland, if it's time for prostate cancer screening, if it's time for your cholesterol test, if it's time for you to start a colonoscopy for colon cancer screening, your primary care doctor should be bringing these things up regardless of when you had your annual physical. It's not just about
breaks up every year for doing my business.
So what is your recommendation for those? Because I'm sure many of us are quite aware of the economy today, and not everyone has health care. Not everyone can afford health care. What would be a great way, or another way that they can maybe kind of keep up with their health needs? Not in a cancer sense, but just in general.
Well, a lot of cities, what I tell people, check with your state, county, and city health departments. A lot of jurisdictions have health departments where you can get free or low cost care, especially for pap tests, mammograms, colonoscopies, prostate cancer screenings, primary care. So check with your local health departments for resources for free and low cost care.
Okay. And Beryl, throughout your cancer treatment, and you're now in the state of a survivor of cancer, how has your eating habits changed from then to now? Do you still eat steak?
No. Every now and then I might eat steak, but I mainly eat chicken, which I'm trying not to do that too. I'm not really a big fish person, but I know I need to eat fish. So it changed when I first was diagnosed, and after all my treatments, I did really well. I exercised, I ate healthy, but then sometimes, I'm not even going to say life gets in the way of life happens, but you're still living. So
Right.
I am aware of the things that I need to cut back on even now, because when I'm stressed, I tend to eat more things that I don't need to eat. And so stress is a big thing that I am really trying to get rid of, to make sure that, hey, everything, I'm even keel, and I know things are going to happen, but if you're working with students, that's different. So yeah.
Mhm.
So I'm trying to do better and get it back together, because I just had my checkup with my doctor too, and she's telling me this thing, look, get it together. I was like, yes, ma'am. Yes, ma'am.
Yeah. Yes.
I think it's
Shantae has
also
another question. Oh, go ahead.
um also talk to your doctor about referrals to see a nutritionist and a dietitian. They can be very helpful with
Ah,
helping you with making those lifestyle changes as far as your food choices that fits your lifestyle and what you have to do every day.
mhm.
Great idea. Thank you. I would definitely do that. It would be nice if I could, if I had a chef, then I wouldn't worry about anything. If
You
somebody
have
would
a
come and cook for me and do that, I'm good. I'll clean the house. If they could just cook, then, but I would definitely do that.
right. A personal chef. That I think we
Absolutely.
all would like that.
Absolutely.
Now they do have meal services, but talk to the dietitian. The drawbacks from that, some of them, a lot of
Are
them
they
are
free,
high in
doctor?
salt. So I have to individually look at those when people present those
Hmm.
to me. But a dietitian can be very helpful with navigating those things.
Okay.
And
Thank you.
So
Shantae has a
Shantae,
question. Go
uh-huh,
ahead.
go ahead. I thought you gonna read Gerald.
So I'm guessing this is for Dr. Bonita. Do you belong to any organizations that work with kids on healthy eating habits from an early age?
So I am an adult physician. I take care of adults, so people 17, 18 until no, but for something like that, I recommend talk to your pediatrician. The pediatricians know all about that. Talk to your pediatrician and find out what's in your community. And also, they have nutritionists and dietitians for kids. Yes, they certainly do.
Okay.
The
Yeah, so I
pediatrician
uh,
can refer you to those.
yeah, and the doctor again hit on a couple of points how eating certain foods or not eating certain foods actually helps across the board. So she's actually she's right about that. You know, I just don't want to eat vegetables for the rest of my life.
Well, like I tell my patients, think of food as medicine. Do you want to eat the good
Yeah,
medicine or do you want to eat the bad medicine? You got to
that's true. You're
decide.
right.
You got to decide if you're going to eat for nutrition's sake or if you're going to eat for something else.
Hmm.
You're absolutely correct.
Now, Dr. Benita, I know you're local here in Maryland, but is your consulting like online too, or do you do it virtually, or?
Oh yes, so I do it virtually. It's all on my website. You can contact me through the contact page on my website.
Okay. And we did drop your link in the chat, so both your links are in the chat. Your books, all that's in the chat, so, in the comments. I'm sorry, in the comments. So everybody go and buy some books, get some reading done.
That's a demand. Is that a demand,
That's
Gerald?
a demand. Yeah, that's a demand. Buy some books. That's becoming a lost art. Reading.
Yeah, it's definitely a conversation that needs to be had, you know, more than just once a month, unfortunately. Because many of us have friends or, loved ones that have experienced this.
Right.
So it's definitely not something that we should all like sleep on too much. So,
So, Beryl, what are three important things that you think people should take into consideration with breast cancer?
Before they're diagnosed or when?
Anything.
Okay.
What 3 things are important?
3 things: to be kind to yourself. Whatever the diagnosis is, to be kind to yourself.
Mm.
Be aware of your body and how it's changing, because as women, our body change. We have kids, our body change. And also, just because you're going through breast cancer, think about your circle of friends. They're going through that with you, like your family, your cousins, your aunts, your mom. And be aware of that too, because sometimes they don't know what to do. They might decide that, hey, they can't talk to you because they're hurting because you're going through that. And that's okay. Then some people might be gung ho and come over and say, hey, let me wash your clothes. Let me get your dinner. I made you an appointment at the spa or whatever. Just be aware of everything.
Okay. And the
And
same.
spouses, like your husbands and wives, and like
Exactly.
these, yeah, that's important. Yeah.
Because I remember when I was diagnosed and I had to be reminded and say, hey, it's not just you going through this. Look at your husband,
Mhm.
look at your kids, because they're hurting too, because they don't know what to do. They don't know how to help you, because you
Right.
have to do these things by yourself.
Then the same question for you, Dr. Bonita.
The first thing I would say is, as far as through, I'll say before, during, and after. So before, it's all about prevention and doing all those things that we've talked about to prevent and lower your risk for breast cancer, which means um, getting those mammograms when they are recommended for you to start, talking to your family members about their medical issues, talking to your doctor about family history and whether you should get genetic testing. Um, many jurisdictions have, and local health systems and universities have free mammograms. So go to your local health departments, state, city, county, local universities. A lot of them have what we call mammo vans in the area. So find those local areas that have free mammograms for you. And then also, during or when you're diagnosed, say, make sure you keep up with your appointments, like Beryl said, keep up with your doctors and the things that you need to do. Um, if you have time, it does not hurt to get second opinions on your diagnosis and treatment recommendations. If you have time to do that, if the explanations that you're getting, if you're not understanding, it does not help to get second opinions about your diagnosis and treatment recommendations. And while you're going through your treatments, a medical diagnosis, uh, you are still the person that you are. You're not the diagnosis that you are. You are still you. And that's what I recommend that people do. You don't turn into the diagnosis that you have been given.
Absolutely.
Awesome. All right. Well, we appreciate
Great
both of you
point.
joining us tonight
Hmm.
and providing this
Lots of information.
lots of information. So the video will stay live, will stay on, so people can still come on and catch the video and hear what you had to say. So I think there's a lot of very good information here, and I hope people follow up and take that preventive care into consideration and prevent it. Some of these things we can be caught early. The earlier, the better. And I think people need to heed those and go to the doctor and don't be afraid to go to the doctor. You know. So anything else you want to add, Tina?
Mammograms do hurt. I'm just saying they do.
So,
You asked.
we'll stop eating that steak then.
Because many people are scared to go because they know it hurts. I mean, it does hurt, but it's prevent. I mean, it does help in the long run, but they do hurt. So the itty bitty committee, just be aware, it still hurt.
Yeah, well, I mean, some things are like that though. And colonoscopy. Have you ever had to drink that drink before?
Yeah. Oh, that stuff.
That's the
Yes.
nastiest stuff you can ever imagine.
Woo. Yes. So, but
You
it
know what
all
I
works. It's all beneficial in the long run. So,
what I tell people, my patients, when they say all what you just said, think about if you don't do it,
hmm,
what are the consequences?
Right. There you
you're
go.
right.
There
What
you
I
go.
say is just do it so we won't be having a longer discussion.
Right.
This is
Yeah.
good one. That's good. You're right about that.
All right. Well, we thank both of you for joining us tonight and putting forth this good information. And we wish you a great evening.
Thank you
Yes.
for having us.
All right.
Thank you, ladies. Thank you. Thank you.
Thank
Bye
you.
bye. All right.
So Buff never was able to get back on.
Never came back. So I don't know who knows what happened to Buff.
We just can't win with her.
I know, right?
And she had a great story too. I really
Yeah.
wanted to hear about that.
Yeah. All
But
right.
yeah, that was good. So and all of the information in the private chat was in the
Yeah, I put
chat
it in the
with
comments. So
it was in the
everything was
comments, right?
everything was put in the comments. So
Okay.
go buy books.
No, the link for her book is in there because I couldn't follow
Right.
everything that was in the comments.
Yeah,
So
it's in there.
oh, okay. All right, good. Okay.
Yeah.
All right. So you gonna end the stream or you just gonna say good night to everyone or what
Good night.
you can say
People off.
you do it this time.
Bye.
Oh my, you're so horrible. You're horrible. See everyone next time. Thank you, everyone. Thank you, Rhonda. Thank you, Shantae. Thank you, everyone who mentioned, had a question or had a comment. Thank you all so very much. We appreciate you. And Beryl, thank you, thank you, thank you. And the doctor, of course, we thank you as well. So until next time, continue to support us because we can't do it without you. Okay, but Gerald, be nice to the people. Okay.
I'm waving bye. That's nice.
Good night, everyone. Say Jian, say Jian. See, this is why we